Have you ever experienced that unnerving sensation of cold, or tingling legs, or noticed changes in the color and texture of your skin on your lower limbs? In today's video, we'll explore the symptoms and causes of poor circulation in the legs and understand why it's essential to keep your blood flow in check. But before we dive into this, please ring that bell for future notifications and subscribe to Healthy K channel for more insightful health content like this on your feed. And now, let's jump right in. Have you ever wondered why your feet and toes sometimes feel icy and numb? Well, this cold sensation often happens when your blood isn't flowing properly to these body parts. Think of your heart as a pump that sends blood all over your body. It carries oxygen and nutrients to every part, including your feet and toes. Sometimes health issues like clogged blood vessels, called atherosclerosis, or narrowed arteries, known as peripheral artery disease or PAD, can slow down blood flow to your feet. This happens because there is not enough room for the blood to pass through. Studies have shown that these conditions can make feet and toes feel cold too. When blood flow slows down, your nerves, which help you feel things, don't get enough oxygen and nutrients. It's like not having enough electricity to power your TV. It can't work properly. As a result, your feet and toes may feel numb, like they're not quite there. The tingling sensation is a bit like when your foot falls asleep. It happens because your nerves are getting mixed signals due to the lack of proper blood flow. You may feel pins and needles or like something's crawling on your skin. It can lead to some serious risks and complications. There's fall risk. When your feet are numb, you might not notice if you step on something sharp or if the ground is uneven. This increases the risk of tripping or falling. Then there's wound issues. If you can't feel your feet properly, you might not realize when you have a cut, blister, or sore on them. Then there are ulcers. Over time, reduced blood flow can make your skin break down and form ulcers. These are painful sores that can take a long time to heal and may even lead to tissue damage. And in the most extreme cases, amputation. Severe circulation problems can lead to such serious complications that amputation of a toe, foot, or leg becomes necessary. Swelling in your legs happens when there's too much fluid building up in the tissues. Normally, your body has a well-balanced system that keeps the fluid in check. Sometimes your body can't get rid of that extra fluid either. This happens because your kidneys, which usually help manage fluid balance, might not be working as they should. When fluid collects in your legs, it's known as edema. Have you ever experienced sudden, sharp pain in your leg muscles, or those annoying cramps that seem to come out of nowhere? These can be linked to reduced circulation in your legs. When your blood flow to the legs is restricted, the muscles may not get enough oxygen and nutrients. Muscles need these essentials to work smoothly, just like a car needs fuel. When deprived of these vital supplies, your leg muscles can start to protest, causing cramps or pain. Think of it like a traffic jam. If the road, your blood vessels, is narrowed, less cars, or blood with oxygen and nutrients, can pass through. As a result, the muscles start to get frustrated, which can cause pain. This connection between poor circulation and muscle discomfort is why you might experience cramps or pain in your legs. Dealing with leg pain or muscle cramps can be a little uncomfortable, but there are ways to manage and alleviate the discomfort. Stretching. Gently stretch your leg muscles regularly, especially before and after physical activity. Hydration. Make sure you're drinking enough water to keep your muscles hydrated. Dehydration can contribute to muscle cramps. Physical activity. Engaging in regular, low-impact exercises like walking can improve circulation and help alleviate leg pain. You should consult with your healthcare provider for personalized exercise recommendations. Medications. Over-the-counter pain relievers such as ibuprofen can help manage muscle pain. However, use them as directed and consult a healthcare professional if the pain persists. Warm compresses. Applying warm compresses to your legs can help relax muscles and alleviate pain. Massage. A gentle leg massage can improve circulation and relieve muscle tension. Atherosclerosis happens when your arteries, the blood vessels that carry blood from your heart to the rest of your body, start to get clogged with a sticky substance called plaque. Plaque is a mix of fat, cholesterol, calcium, and etc. It's a bit like when you have a sticky residue on your hands that collects dirt. This plaque sticks to the walls of your arteries, and as it builds up, it makes the blood vessels narrow and less smooth. Just like when your sink gets clogged, the water, or blood in our case, can't flow freely, which can lead to problems. Several things can increase your chances of getting atherosclerosis. High cholesterol. Having too much bad cholesterol in your blood can lead to plaque buildup in your arteries. High blood pressure. When your blood pressure is consistently high, it can damage the walls of your arteries, making them more prone to plaque buildup. Smoking. Smoking is like throwing fuel on a fire. It damages your arteries and makes it easier for plaque to stick. Diabetes. High blood sugar can damage blood vessels and speed up plaque buildup. Obesity. Being overweight can increase your risk because it can lead to higher cholesterol and blood pressure. Family history. If your parents or close relatives had atherosclerosis, you might be more at risk. Aging. As you get older, the risk of atherosclerosis increases. Inactivity. Not getting enough physical activity can contribute to atherosclerosis too. Let us simplify peripheral artery disease. It's like when a narrow, winding road suddenly becomes even narrower, making it difficult for cars to pass through. In PAD, the road is your arteries, which are the blood vessels that carry oxygen-rich blood from your heart to your limbs like your legs. PAD happens when these arteries become narrow or blocked due to a buildup of fatty deposits. It's similar to when leaves and debris clog up a drain pipe. As the arteries narrow, they can't deliver enough oxygen and nutrients to your muscles, especially in your legs. This shortage of oxygen and nutrients can lead to pain, cramps, and other problems in your legs because the muscles aren't getting what they need. It often goes hand in hand with other health conditions such as heart disease. If you have PAD, you're more likely to have blockages in the arteries of your heart as well. It's a bit like having a traffic jam in your heart and legs. High blood pressure. This condition can make the artery walls weak and prone to damage, which can increase your risk of PAD. Diabetes. High blood sugar levels can harm blood vessels, making them more likely to develop PAD. Smoking. Again, smoking is like pouring fuel on a fire. It's one of the top causes of PAD and can make the condition worse. High cholesterol. High levels of bad cholesterol can lead to plaque buildup in your arteries, which is a major factor of PAD. Obesity. Being overweight puts extra pressure on your arteries, increasing the risk of PAD. And age. As you get older, the risk of PAD also increases. Understanding that PAD is not just a problem on its own, but can also be connected to other health issues is important. By managing these related conditions and making healthy lifestyle choices, you can reduce the impact of PAD on your life and overall health. Diabetes has a significant impact on your blood vessels, which are like the highways that carry blood throughout your body. In diabetes, these vital pathways are affected in several ways. First, your blood can become thicker and stickier, similar to syrup rather than water. This makes it challenging for blood to flow smoothly through your vessels. Additionally, high levels of sugar in your blood can gradually damage the walls of your blood vessels, akin to tiny scratches and dents in water pipes. This damage weakens the vessels and causes them to narrow over time. Moreover, diabetes can lead to more plaque buildup in your arteries. Plaque is a sticky substance that adheres to the walls of blood vessels, further restricting blood flow. Controlling blood sugar helps prevent or slow down the harm that diabetes can cause to your blood vessels. When you maintain good blood sugar control, you reduce the damage it inflicts on your blood vessels. This preservation means your arteries remain healthier, allowing blood to flow more freely. Effective blood sugar control can also help prevent or slow down the accumulation of plaque in your arteries, a significant factor in poor circulation. Furthermore, by regulating your blood sugar, you lower the risk of complications such as nerve damage and kidney problems, which can also impact circulation. Monitoring your blood sugar levels, taking medications as prescribed, and making healthy lifestyle choices like adopting a balanced diet and engaging in regular exercise are essential steps in managing diabetes. By doing so, you not only protect the health of your blood vessels, but also ensure better circulation and overall well-being. Blood clots are like unexpected roadblocks in your blood's journey. They are semi-solid clumps that form when your blood thickens and sticks together. Blood clots in veins can obstruct the normal flow of blood, reducing circulation. In the legs, these clots can lead to pain, swelling, and warmth in the affected area. They can also cause redness and make the skin feel tender. Sometimes, a piece of that clot can break off and travel through the bloodstream, causing more severe issues if it gets lodged in the smaller blood vessels in the lungs or elsewhere. Certain factors increase the risk of blood clots. These include prolonged immobility, recent surgery, a history of clotting disorders, smoking, obesity, and some medications like birth control pills. While you can change some of these risk factors, there are steps that you can take to lower your risk. such as staying active, staying well hydrated, and avoiding long periods of immobility during travel. So there you have it. What do you think? Did you find the information about varicose veins or blood clots and how they affect circulation helpful? Do you have any other suggestions for these issues? Let's start a conversation down in the comments below, and don't forget to hit that like button and subscribe to the Healthy K channel. As always, thanks for watching.